Hey beautiful people, and welcome back to my channel. Today's video I'll be taking you guys through the practice questions provided by Pearson Vue for adult nursing clinical practice. So this is the part B. The part A is the one where you do drug calculations, while the part B is where you are tested in terms of clinical nursing. So as someone who is experienced, as an experienced nurse, I decided to take you guys through and just explain everything to you. So as usual, the link will be in the description or comment section. And if you are confused about any part, don't forget to comment it in the comment section area, and don't forget to use your timestamp. So without wasting much time, let us dive right into it, guys. Okay, welcome back. If you're seeing me for the very first time, hi, my name is Samuel and I am a registered nurse. I've been practicing for quite a while. I've practiced in both nursing homes and in hospital, in emergency areas and in children wards area, but that is not particular to this video anyway. So in today's video, I'll be taking you through the clinical aspect of CBT. CBT simply means competency-based test, and this is the test that you are required to write if you are planning to come to the United Kingdom to practice as a registered nurse. So this clinical aspect consists of, in your exam, consists of about 100 questions, I think, and you are required to pass to some extent, I'm not sure, 50%. So we have a practice questions of 50 questions, and we are going to try as much as possible to answer them and explain everything to you in a way that you would easily understand. So to make things easier for you, if you are someone who loves reading voluminous books, you can get ahead to get this Royal Marsden Clinical Nursing Textbook. It will greatly help you in your journey of relocating to the United Kingdom to practice as a registered nurse. And I believe that some of the questions that you find in this competency-based test are taken from that textbook. So without wasting much time, let us go into the practice questions. So as you can see on the screen, you would be given some instructions. These instructions are vital because it's not just about knowing the correct answer, but writing it in the right way, because your questions will be marked by a computer. Always remember that. These practice questions is to show you the time on the exam, how things go, just basically to prepare you for how the exam looks like. Now let's go into it. Which of the following describes a quantitative method of research? Choose the correct answer. So quantitative means what? Something that can be quantified. That means like numbered. So A says collecting people's views and opinions. B says exploring a phenomenon by interviewing participants. C says reviewing published research. D says collection of numeral data. We'll be choosing collection of numeral data. So if you are in need of calculator, all you just have to do is to click here and you would see your calculator right here. Your calculator is just by the side. And then you can click on this objective and it will like give you a hint of what that question is aiming for. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. D is our answer for this question. When caring for a patient who is Jehovah's Witness suffering a severe hemorrhage, what do you consider? Choose the correct answer. They are not to receive blood or blood products. They are not to be resuscitated. They are not to be sedated. They are to be cared for by professionals who are JW. They are not to receive blood or blood products. When caring for a patient who does not speak English, how do you obtain information from the patient? Choose the correct answer. A. Ask a family member to translate. B. Use a face-to-face or online translator. C. Ask the patient to draw pictures. D. Find the information you need from medical notes. Use a face-to-face or online translator. Okay, so the reason why I think we are not to choose family to translate is because some things are meant to be confidential and probably your patient does not want the family to know. So that is why I chose that answer, that get a face-to-face or online translator. Okay, the next question says, when a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. A. Inform the patient of what has happened. Continue to administer the next dose. Continue your drug round. Call the patient's family. I think it should be call the patient's family. So if you are not sure about any question, you can always flag for review. To be honest, I don't think I'm going to do well in these questions because the HPV vaccination prevents which disease? Is it ovarian or cervical? I would go for cervical cancer. No, I think I chose the wrong one. Oh dear. Which of the following professions are specifically trained in smoking cessation? Definitely a hypnotherapist, I think. I'm not so sure, but I know that a chiropractor has to do with bones, or dietitian has to do with nutrition, pharmacist has to do with whole of medication. So I'll choose that one. And again, you can flag for review. Okay, the next question says, which of the following diseases is notifiable to Public Health England? Choose the correct answer. You know what, don't be too bothered if you get the right answer or not. So for this one, we can just go ahead and choose Clostridium, no, communicable diseases, human papilloma virus. I'm doubting between that or influenza, whole of medication. So I'll choose that one. And again, you can flag for review. Okay, the next question says, which of the is notifiable to Public Health England? Choose the correct answer. Don't be too bothered if you get the right answer or not. So for this one, we can just go ahead and choose Clostridium, no, communicable diseases, human papilloma virus. I'm doubting between that or influenza. Which of the following is a health visitor's responsibility? Choose the correct answer. A. Assessing speech and language development, administering immunizations, giving emergency first aid and treatment in a crisis. That's the correct answer. What are the common complications of uncontrolled blood sugar in diabetes? Ketones. Choose the correct answer. Renal failure, joint pain, urinary incontinence, no. Retinopathy, yes. Peripheral, yeah. Renal failure. Okay. A doctor requests a lactate test to be taken from a very unwell patient. What type of sample is taken? That would be blood gas. Yeah, I'll go with blood gas. On scale 2 of the news 2 chart is used for which patient group? Okay, so the scale 2 is this. Now, our question says the scale 2 news 2 chart is used for which patient group? So, A, those who have been exposed to carbon monoxide. B, those receiving intravenous therapy. Those with carbon dioxide retaining patients. So the next question says, patients with chronic pain conditions are screened for which of the following? Choose the correct answer. A. Schizophrenia. B. Low mood and depression. C. Coronary heart disease. And D. Bowel cancer. I think this will be our answer because it's the only thing that I can see here that is relating to pain. Which of the following groups has the highest rates of suicide? It's men. I am 100%, no, 99% positive that it's men. So I chose men. Next question says, a patient presents with a productive cough, low saturations, high respiration rate, raised lactate with news 2 of 9. Which of the following does this indicate? I think it indicates chest sepsis. Yeah, I'll go for chest sepsis. Prior to surgery, how long are oral fluids withheld? Please choose the correct answer. 2 hours. Next question says, what group of drugs are used in patient-controlled analgesia? Opioids, of course. Next question says, patients who are put on furosemide are warned of which common side effect? It's polyuria, because furosemide makes people urinate often than usual. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? Choose the correct answer. Give 5 more back slaps. No. Start a basic light stop up. No. Give 5 abdominal thrusts. After then you go and you hold them like this to their, and then you pull thrusts. You are caring for a patient who has a stoma formation and they are ready for discharge. What advice do you give the patient? Choose the correct answer. Use perfumed soaps to aid odor control. B. Wait until the bag is full before changing it and clean with soapy water. C. Keep the area moist when changing the bag, advocating the use of oils to help the surrounding skin. C. Clean with water, trying to keep fecal fluid away from skin to minimize irritation. I'm just going to choose this, but I am not sure. What is the responsibility of an occupational therapist? Choose the correct answer. Supporting people whose family may prevent them from completing their normal activity now, reviewing and adjusting now, assessing injury or damage in a patient. It's supporting people whose health may prevent them from completing their normal activity. Our next question says, whose role is it to lobby the government to support nurses and make positive change to the profession and working conditions? This one is obviously the nursing unions, but then I don't know about the hospitals in the UK, how they are, but I hope I'm right. What does it mean to performance manage an employee? Choose the correct answer. A. Developing a person to fulfill the expectations of their role. B. When someone is being dismissed from their workplace. C. When a person is promoted. D. When performance is exceeding the expected level. No. Developing a person to fulfill the expectations of their role. When running a ward or unit, which of the following is the priority at the start of the shift? Choose the correct answer. A. Make sure a doctor is on the ward. C. Check the staff numbers, match patient acuity, give out breakfasts, calling and updating. No, I think it should be to check the staff numbers. I just hope I'm right. We're always short-staffed anyway. When supervising a student nurse, when do you deliver feedback? A. Continuously throughout the placement. B. At the end of the placement. C. Feedback is provided by the university, so you don't need, it should be at the end of the placement. What is a whistleblowing policy? So whistleblowing is like, maybe I work for a company now, and that company, they sometimes do some terrible things, like things that are not legal, you know, especially towards patient care. Maybe people are beating residents or patients, and of course I know that this is not right, but I can't really say because I'm a worker there and I don't want to lose my job and I just want to protect myself. So the act of me finding a way to get this information out is whistleblowing. But now some companies have whistleblowing policy. I believe most companies should have it. So this is what this question is all about now. A policy that helps employers manage staff, a policy that guides staff on raising concerns about safety and practice. I think it should be this one. So, when undertaking research, what is the first step? Oh, I think it should be selecting a topic because you have to choose what to work on first, right? So I will just go with that. What is the main purpose of root cause analysis? A. To ensure that reoccurrence is avoided, to provide data about the incidents to the Department of Health, to assess if those involved require compensation, to identify who was responsible for the incidents and performance manage them. I'm just going to go for this. Who will notify an emergency department that a major external incident has occurred? Choose the correct answer. The answer should be the nurse in charge of the department. When noticing that a colleague is suffering from low mood and depression, what actions should be taken? Choose the correct answer. Been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions. Choose the answer. Ensuring students have maths and English preceptorship trainings. Yeah, it should be preceptorship trainings. Who is in attendance at a child protection case conference? Oh, I'm not so sure of this, but I think it should involve the family, health, and educational social services. What could help a nurse understand the preferences of a patient with dementia? Please choose the correct answer. So dementia is also known as Alzheimer's disease, and this is where people like basically forget who they are, they lose their memory. Sometimes they wander around, sometimes they say irrelevant things, or they just say gibberish. Like, it's something that is very common in the UK. I think it is one of the leading causes of death in the United Kingdom, and it affects a lot of the elderly in the United Kingdom. So if you end up choosing to work in a care home, you will be seeing a lot of this, because that's what makes most people end up in a care home. Okay, so back to the question. The answer should be, this is me document, because this is a document that you will see the picture of the resident. It will tell you like their name, their date of birth, what they're like, their music, their type of their food preference, just a lot of things. You could want to say the handover sheet, but no, it's the this is me document. So next question says, who should be notified when attending hospital with a school child aged 8? Choose the correct answer. This question is a bit tricky, so I'll choose school teacher and flag it for review. So let's go to the next question. There is a requirement to increase nursing staff on a ward due to an increase in patients' demand. What steps are taken? Choose the correct answer. Go directly to Human Resources, HR, and ask them to recruit. Ask the team to increase their working hours. A business case is written to increase nursing staff numbers. Reduce the number of patients to the no. I don't think our answer can be A, so I'm just going to go for C. Now the next question. When failing a student for professional values, what steps are taken before the end of the placement? Choose the correct answer. Contact the university and get them to inform the students they have failed the placement. No steps required as long as the fail is documented clearly in the assessment. Inform your line manager so they can inform. I think I'll just go for this last point, which is a midpoint interview, where you are able to give feedback and allow students to develop an action plan to achieve. Okay, I think because I don't work in the NHS, I won't be too sure of this, because we answered a question earlier that said, when should you give feedback? Anyway, motivational interviewing is best described as a method to use to encourage people to adhere to discharge advice. A tool used in appraising staff development. A tool used in peers. No, a method of assisting people with health behavior change. I'll just go with A. What is the best method of delivering advice to patients with a new diagnosis of a long-term condition? Ensure there is a range of materials available and present for the patient to take home after the consultation. Advise the patient to look up any questions. No. Give all information. No. Information and diagnosis given. No. I'll just go with A. ANTT simply means aseptic non-touch technique. Antiseptic. No, it's aseptic. Which of the following is not considered to be an aerosol generating procedure? What's an aerosol again? Okay, so an aerosol is like tiny droplets, and I think we'll just go with assisting of medication, since that is the only thing that does not really like involve you like bringing out blood or bodily fluid. I think aerosol can just be like bodily fluid in that aspect. A wheeze is commonly heard on auscultation in which of the following conditions? That should be pneumothorax, or is it pulmonary edema? To say pneumothorax. Emetemesis simply means blood in the vomit. When caring for patients at the end of life, a family reports that they are concerned that the patient is suffering from dehydration. What action is taken? Advise the family that this is a common symptom that is unable to be resolved. Ask the family to encourage oral fluids more. No. Start measuring the urine output to diagnose that. No. Ensure. No. So the only thing is that we can advise the family that that is a symptom. But I'm not sure of what stage of end of life this is, because when somebody is at the final stage of end of life, they tend not to drink anymore, and they can't eat anymore, so you can't really push down fluid. So that is why I'm selecting that option which I've selected. A person over the age of 70 with a respiratory disease is encouraged to obtain which of the following immunizations? Flu vaccine, I think. What medication is given to someone to prevent the long-term disabling effects of acute ischemic disease? Like Zane. It's a blood thinner. When discharging an adult with an acute wound, who is the patient referred to for wound care. That should be the district nursing team. District nursing team, they are the people that come to homes to care for people. They are like they go around homes. They don't have like a hospital. They will nurse people in the community. Research suggested that the majority of in-hospital cardiac arrests were avoidable. This led to the introduction of what? News score. News score is like a warning. It's like a tool where you assess somebody based on the symptoms they're presenting, and they know if you are calling an ambulance or not. If I get a picture, I'll put it on the screen somewhere around here for you to see. So it's a tool, and there are so many tools here like Abbey Pain Scale, Bristol's tool chart, a lot of things like that is used in nursing in the United Kingdom. Okay, I thought we answered this question earlier. Okay, this is me document is implemented to aid in care for which patients group? Patients with dementia. Oof. So we have come to the final. We got 16 questions wrongly. That means we passed how many? 34, which is not too bad because I have not practiced this. I just came back from work now and I just opened this to make this video and to show you guys how this is done. And I've not read something in a long time. So let's just review the incorrect. When a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. Okay, it should be to inform the patient of what has happened. Oh, so I got that one now. So number 7 now says, which of the following professionals are specifically trained in smoking cessation? So I'm just going to choose a pharmacist now and see. Let's go back to review screen. Okay, so that one is correct as well. So let's check number 8 now. Which of the following diseases is not... I think this should be mumps. So if you think you can easily do this as well, and that's why I'm just showing you guys that I don't know it all. So let's just do it together. So the next one, which of the following is a health visitor's responsibility? Should probably supporting the physical and emotional growth of a child. Yes, correct. So number 13, patients with chronic pain conditions are screened for which of the following? Probably coronary heart disease. Well, I didn't even think of this question very well. No, low mood and depression. Yes, that is right. So the next question that is incorrect says, when supervising a student, when do you deliver feedback? Continuously through the placement. That should be our answer, yes. Then the next question, I think this should be the ambulance service lead, if it's not that one. Yes, that is right. I think I'm being too fast. I'm so sorry. Please just pause if you think I'm being too fast. Okay, so the next question says, what has been implemented to ensure that nurses are fit to practice? New pre-registration education standards, I think. Yeah, so this one should be the school nurse, who should be notified when attending hospital with a school child. I think that should be the school nurse or local children's center. School nurse. Yeah. So the next question says, this one, did I even think about it? So we got that right. This one I'm not so sure. I'm just going to choose one of this. Yeah, motivational interviewing is described as a tool used in appraising staff for development. I think 5 incorrect. Okay, we got that right. Which of the following is not considered an aerosol? Which one should it not be? Performing oral hygiene, maybe? So the answer says blood transfusion, but I'm not too sure about this. So please make your research about that and comment in the comment section, because I'm a bit confused about that question as well. Yeah, I knew this would be... Yeah, acute asthma for that one. So the case of dehydration, yeah, I did see about this question earlier. Okay. So the answer is to ensure subcutaneous fluids are commenced. Okay, then the final one. When medication is given to someone to prevent long-term disability, thrombolysis. And that is it, guys. We have finally cleared all that we got wrongly. So I just hope that I have been able to put you through all of how to do the adult nurse competency practice questions provided by Pearson Vue. If you enjoyed this video, make sure to give us a thumbs up, like, comment and share, and I hope to see you in subsequent videos. So until next time, bye.